Deputy Seán Crowe wishes to discuss the growing waiting list for speech and language supports for children in Dublin South West.
And I'm taking this.
Yes, Deputy Crowe.
Good morning. Minister, I've raised this directly with the Taoiseach, raised it with the Minister for Education, wrote to the Minister for Health, the Minister for dealing with disability, and also the Children's Minister. And I'm hoping today that maybe we get some sort of answer here today in relation to this. I suppose you'd agree, Minister, that the idea that I think it's absolutely appalling that a child with profound and complex needs has to wait 42 months to get the attention of a team for its needs to be assessed and hopefully addressed, and and get speech and language therapy. But that's the waiting time, the official waiting time for a child in the CHO7 area. Now, in June, I wrote in relation to one child who's been waiting to 2016, and I was told at that time that there was 95 children ahead of this particular young child, and the team were working at maximum capacity, and were dealing at that stage with referrals back in May 2015. Then in December, I wrote again about a separate case, and again I was told that there was 298 plus a further 80 currently being screened children on the speech and language waiting list, and there are further 8 children waiting transition from early intervention to the speech and language. There are currently 222 ahead of this particular child. So the waiting time is 42 months. I was also told in the reply then that there's been no movement on the list in the last 11 months due to the volume of children that are transitioned from the early intervention service, the capacity caseloads of team members, delays in filling of vacancies, maternity positions not being backfilled. And then I was told the actual staff that are missing. There's a staff grade education vacant since December for a psychologist. Staff grade psychologist, half post, again vacant, only available half the time at present. Senior speech and language therapy, half position missing. So, and right down there's others missing there, social worker, staff grade physio and so on. So clearly the team itself is broken, that it's not fixed, and I suppose that's why there's a backlog in relation to it. I think there's been a significant increase in health and social care professionals is required to adequately meet the demand for children in this particular area. I think clearly additional resources are required to address the backlog, because again I think it's unfair on any child being left in this position. I think, as one expert said to me, that for every day that a child is left without this support, it's backward step of 2 days. So you're talking about a child waiting 3.5 years. We're talking in reality probably 7 years of that child's development. That can't continue, Minister. The latest census would suggest that demand with an increase in population and increasing prevalence of disability will increase the time ahead. So families and parents, I think, they're at their wits' end. And where do they go from here? Clearly, the system is broken. One suggestion has been, go down the private route, which is a costly alternative. Many of these families that are coming to me aren't in that position that they can actually go down the private route. So I'm asking, Minister, would you agree that the policy of early intervention is not working if children have to wait 42 months to get access to a team, and God knows how long then to wait for the actual speech and language therapy?
Thanks, Ken Corla. And again, on behalf of Minister Harris, I want to thank Deputy Crowe, and just to make an opening comment myself, as the CHO7 area covers my area as well, and some of the issues that Deputy Crowe has spoken here this afternoon on is some of the issues that I'm dealing myself on a daily basis, and it is very disturbing and frustrating for parents who are left waiting for such a long time. Anyway, I will take this on behalf of the Minister. I want to thank the Deputy for raising a very important matter, for providing an opportunity to update the Dáil. The Government accept that there are challenges in relation to access time for speech and language therapy services, and this is a concern for parents and their families. At the same time, I wish to assure the Deputy that every effort is being made to reduce waiting times, both nationally and at local level in Dublin South West. The challenges we face in ensuring timely access to services should not be underestimated, not only in the demand for SLT and other therapy services increasing across the country, but the HSE report that the complexity of individual cases is also increasing. Turning specifically to the situation in Dublin South West, the speech and language therapy team, their works across both primary care and disability services. In the primary care sector, the majority of the service is focused on the needs of children under the age of 18. Some 1,377 referrals were accepted in Dublin South West in the 11 months up to the end of November in 2017. The current position is that 713 people are waiting to be seen for initial assessment, and 244 of whom are waiting for over 1 year. All those waiting over 1 year are under 18 years of age, with the majority of these individuals awaiting specialist disability, multidisciplinary team assessments and interventions. In addition, 313 individuals are waiting for initial interventions following assessment. It gives me no pleasure to inform the Deputy of such numbers, and Minister Harris is extremely concerned that these figures conscious that behind these figures are real people seeking care and support. Access time for SLT services are too long, and it is for this reason that we have introduced a range of measures to address the problem. Funding was provided in 2016 for speech and language posts. To prioritise the longest waiting children, CHO was allocated additional 16 posts under the initiative. Other actions taken to improve services in the area include establishment of a drop-in clinic which will provide advice and support, provision of maternity leave cover, introduction of new models of working. Our particular note is that in-house school and language therapy demonstrates project now up and running in CHO7, Dublin South, Kildare and West Wicklow. The joint collaboration between the HSE and the Department of Education and Skills and the Department of Children and Youth Affairs provide occupational therapists and speech and language therapists services across 150 schools and preschools. Under this scheme, children can receive in-house therapy services which aims of delivering therapeutic interventions as early as possible to support children's social skills, mental health and academic performance. The HSE National Service Plan 2019 reflects this Government's commitment to improving access to primary care services such as SLT. It contains provision for the recruitment of 170 additional community nursing and therapy posts and sets out a target of 4,500 additional patients to be seen in 2019, with a full year impact in 2020 of 9,000 additional patients seen. In addition, 100 additional therapy posts are planned to reduce waiting times for assessment of need under the Disability Act 2005. The Government appreciates the delay in accessing services can be difficult for family and children affected. However, the recent investment in speech and language therapy posts, along with new ways of working such as in-school projects, will support improved access to services and have a favourable impact on the long waiting list, including children. Furthermore, in 2019, National Service Plan also contains a number of provisions aimed at improving access to therapy services. The additional investment should make a real difference to patients and their families. And I will come back to the Deputy then.
Deputy Crowe.
I suppose the reason we raise these issues is to try and get some sort of action in relation to it. I'm aware that in part of the budget for this year there was 100 new therapy posts have been allocated in the budget, but yet, as yet the area hasn't been advised how many will be allocated to the CHO7 area. So I suppose what I'm calling for here, the Minister, is that clearly this area needs to be prioritised. It's unacceptable that any child would have to wait 42 months for access to key services that will transform that child's life. If they don't get it, that child's development is impacted on it. So I suppose that's one positive area that I could ask you, Minister, to go back to Minister Harris and ask him to use whatever influence he has in relation to this, that clearly the system and the gaps I've outlined, the gaps that are there in the team in the area. I don't blame the team that are operating now with Chamber House. They don't have the key personnel, they don't have the staff, so it's clearly not, it's not their fault, but it's the families and those children who are impacting, who it's being impacted on. I've tried everything, Minister, in relation to it. I don't know what else I can do. The only thing I can recommend to these families is to actually go to the courts. Now, I don't want any family to have to go to the courts to get what their children are entitled to. But that seems to be the only option that is going to be open to many of these families. Now, that's going to be a costly affair. It's going to cost the state. And at the end of the day, the state will have to deliver services for these children. It's clearly not doing that at the moment. And no one can stand up and say that the system is working in this particular area. I think the response you've given me today is actually even more depressing than the figures that I've actually outlined myself. Clearly this is something that needs a greater focus from the Minister. I realise he has other difficulties as well, but this is, these are vulnerable children. It's not going to only affect them now, but it's going to affect them as they get older and older into life itself. So I'd ask that whatever resources we can allocate to these children be put in place, and in particularly those additional resources that have been budgeted in the 2018 budget, that clearly this is one area that needs to be resourced and needs to be resourced immediately.
Crowe, Minister, to conclude.
And again, look, Deputy Crowe, numbers speak louder than words, to be honest with you. And when I read this before I came down, I was shocked as well at the numbers. I have to acknowledge that. But I know the Minister acknowledges that as well, and he is concerned that it has taken so long. And particularly in light of the amount of children that are under 18 and still haven't been assessed, and the individuals waiting, but also the complications of multidisciplinary team access to assessments and interventions at a very early stage, I think is so important. And I suppose in many ways that's why the new in-school support service has been put in place. And as a grandparent, I witnessed that with my own grandchildren recently, the way the services is started to work in the schools as well. And Deputy Crowe, I acknowledge the fact that you have raised this with the Minister, with the Taoiseach, and has pursued it as you have today as well. And I will give you my, and I know I always say this, Corla, and I really mean it, I always go back to the main Minister and I outline the concerns and the anger and the state of some of the services that are out there, and I suppose, embedding them, that the concerns that have been raised by, we don't come into this chamber to raise these concerns unless they're affecting the people in our communities we represent. We have a lot of work to do in this particular area, and I know that myself in my own area, which I represent as well, and in some of our particular Deputy Crowe's and my areas and other places where people are less fortunate and maybe living in other multiple problems we're in communities as well. Sometimes they can be left behind, but I do hope that over the coming weeks and months, that as soon as Minister Harris is back within the House, I will raise the issue with him as well, and I'll raise it as well with the Taoiseach when I do see him. There's a lot going on in the House, as everybody knows, but I think these that affect children and affect people in our communities are so, to me, to be prioritised, and they should be dealt with. And can I just pay a compliment to the people who do work in the services, in the primary care services, and particularly with speech and language and other services within communities, that they do a very, how would I say, a job that sometimes needs not only just a lot of compassion, but it needs a lot of energy as well, because they are working in under difficult situations. So I do hear the concerns of Deputy Crowe, and I will make it my business.
Thank you very much, Minister.